Hey guys, today we're going to learn about the fascial spaces. First of all, the simple meaning of the term fascia is a broad sheet of dense connective tissue. Its function is to separate structures that must pass over each other during movement, like muscles and glands, and it also serves as a pathway for the course of vessels and nerves. There are different layers of fascia, and the space between these layers is filled with a loose type of connective tissue. Infections can spread from one location to another easily via this connective tissue. So, infections may travel along these fascial sheets. That's why we need to study these layers. In the head and neck region, there is the superficial fascia and deep cervical fascia. Superficial fascia is the layer of dense connective tissue that is found deep to the subcutaneous tissue, and this is not just in the head and neck area, it is present throughout the body. What you should remember is that the superficial cervical fascia blends with the platysma muscle, which is a broad superficial muscle which lies anteriorly in the neck. Deep cervical fascia lies deep to the superficial fascia and the platysma muscle. The deep cervical fascia is organized into three layers: investing, pretracheal, and prevertebral. So we will see them starting from the most superficial layer to the deep layer. This is the transverse section of the neck. So first of all, we have the anterior layer, which is also known as the superficial or investing layer of deep cervical fascia. It encircles the neck, as you can see, and it splits to surround the muscles sternocleidomastoid and trapezius. So you can see this investing layer of deep cervical fascia is enclosing these two muscles, and posteriorly it attaches to the spinous process of the cervical vertebrae. Understand that this is the anterior part of the neck and this is the posterior. Anteriorly we have the sternocleidomastoid and posteriorly there is trapezius muscle. So what you need to remember is the investing layer of deep cervical fascia splits and surrounds these two muscles. You can think of the investing fascia as a tube with superior, inferior, anterior and posterior attachments. Superiorly, it attaches to the external occipital protuberance and the superior nuchal line of the skull. Anteriorly, it attaches to the hyoid bone. Inferiorly, it attaches to the spine and acromion of the scapula, the clavicle and the manubrium of the sternum. And posteriorly, it attaches along the nuchal ligament of the vertebral column. Then there is the pretracheal layer. You can see this is the trachea. Trachea is in the anterior neck, so this layer is obviously situated in the anterior neck, and its extent is from the hyoid bone superiorly to the thorax inferiorly, where it fuses with the pericardium. Now, as the name suggests, pretracheal layer surrounds the trachea, and it also surrounds the structures that surround the trachea, that is the thyroid gland, esophagus, and as we have seen, its superior extent is till the hyoid bone. So it surrounds the infrahyoid muscles, that is the sternothyroid, sternohyoid and omohyoid. The prevertebral layer surrounds the vertebral column and the surrounding muscles, scalene muscles, prevertebral muscles and the deep muscles of the back. Another important structure here is the carotid sheath. This carotid sheath is formed by contributions from the pretracheal, prevertebral and the investing layer. So all the three layers form this carotid sheath. As you can see, this is a paired structure on either side of the neck. The contents of the carotid sheath are common carotid artery, internal jugular vein, vagus nerve and cervical lymph nodes. So there is an artery, a vein and a nerve. These were the basic layers of fascia. Now what are fascial spaces? The fascial spaces are the potential spaces between the various fascia, and these are normally filled with loose connective tissue. The important word here is potential. It means the fascial spaces do not exist in a normal healthy individual. So, when we learn about all the spaces and boundaries of the spaces, there is no actual space present. These spaces are only created when there is distension of tissues because of infection from the dental pulp, periodontal tissues, and bone. So, remember, in a healthy individual, there is only loose connective tissue in between these fascial layers.